I'm excited to talk and introduce a new service that we've got available at the Rehab Hub, and that is blood testing, so pathology at the Rehab Hub. One of the big missing elements within our private practice was that link up with blood testing, and a lot of patients were struggling to get an appointment with their GP to be able to get the diagnostic testing that they needed. The NHS is hammered at the moment. Most patients have been told only to go if they absolutely necessarily need to. And what was happening is that there was this bottleneck. So way back last year, I did my phlebotomy, put your teeth back in, SJ, phlebotomy training, which is basically a specialty where you're trained to take blood samples. So I needed to do that training anyway for PRP injections. And as part of that, obviously, I can draw blood. So it's a new service that I've been working nearly a year now to get into the Rehab Hub, because I've seen it as a requirement to best help patients. So there are certain tests that were getting bottlenecked at the NHS. So what this means is, it doesn't just mean that you can just decide, oh, I fancy getting a massive big blood screening, lots of testing done. I've got to ethically test with justification why you're needing that testing. I can't just send you away for lots of tests. That wouldn't be ethical. But the types of things where, for example, we would do here, if I just pull up the page, I've put the links to booking and things in this if you're interested. So the types of things that we would be taking charge of are, for example, HbA1c. That should be getting done on a 3-monthly basis. If you have type 2 diabetes, it should be getting monitored. And for a lot of patients, they're falling through the net with that. And diabetes is quite insidious. You generally will feel okay. But if your blood sugar levels are, raging high, and you're not keeping control of that and tabs on that, then the consequence of that can be extremely detrimental to your health. So things like that, getting your kind of regular HbA1c, it means that it can all be done within in-house. We get the results back usually for something like that within the day. And it's all there nice, neat and tidy. There's no need for us to refer you back into the NHS to then weigh or go to different health centres to get your appointment. So if you have type 2 diabetes, you want a nice, easy, simple service where you're getting your foot screening, then we can provide that service of your HbA1c testing. That's no problem to do that. To give you an idea of prices of that, for your HbA1c, the full reporting, you're £51, so not ridiculously expensive. Glucose testing as well. So say, for example, we suspected that you may possibly have type 2 diabetes, then we would be able to basically test you for that as well. That type of test would be £30. So again, not a big deal. These would be on top of your normal consultation. Our consultations, if you're a new patient, are £60. If you are an existing patient, they're £55. So your blood screening, any kind of testings, your testings would be on top of that as well. In terms of other testing that we can do, and this has been one that's been a big major frustration for us. So as a podiatrist, we see, and we're generally the first people to notice things with people's health. So whether it be, just doing a routine check of a patient's blood pressure and realising that there's maybe some more things that need to be looked at there, right down to rheumatology issues. So usually what we find in podiatry is that we're the first to notice something's wrong. Your feet are attached to the rest of your body, and they are the end arteries. Usually when we have any neurological or any systemic things going on, your feet show it first. And generally you can just tell by looking at somebody's feet, you get a good indication actually of their vascular health, their neurological health, their overall general well-being really. And for a lot of things, we are usually the first to pick up issues with rheumatology, so inflammatory, systemic, autoimmune type problems. And again, this has been a bit of a bottleneck with the NHS getting proper assessments. So this is something that we can help with. So if for any reason that we suspect that there is any immune system involvement, then we are able to do a full screening of that and absolutely rule any autoimmune problems out of the diagnosis. So that is something that we can absolutely help with, and it's something that we found was a little bit frustrating. Some practices actually are excellent. Some GP practices are really on the ball with this sort of stuff, but unfortunately, many are absolutely overwhelmed and not as easy to get those referrals happening fast enough. And it's quite, if you're waiting in blood results or you're waiting for that referral, it's quite stressful. It's a stressful time. And, the sooner we get the results back, the sooner we can get a plan in place. So things like that, we'd be looking at a kind of full blood count, your ESR, we'd be looking at liver function tests, we'd be looking at your inflammatory markers. So basically ruling out there isn't any immune system involvement. And then from there, what we'd then be able to do, if something did flag up or something just wasn't looking quite right, that can then go with the GP with their referral. So we would send a referral letter to the GP with a report of findings, what our working diagnosis is, and then onward referral to rheumatology. So it would expedite that process for you. It would just get you into that referral to rheumatology if that's needed that little bit quicker. So it would just get that ruled out. So things like that it can be really useful for. Also just, say for example, we wanted to check if there's any inflammatory involvement, or if we were going to do a surgery and we wanted to check liver function, kidney function, certainly some of the local anaesthetic. If we were going to do like a nail surgery or something, we might want to do some screening prior to that as well. So it can be quite handy for that. Some of those screenings are around kind of £20, £30. So they're not, again, a major cost to you, but it's a massive convenience in terms of joining up that service. So if it's something that you're interested in, please don't hesitate to reach out. We can do pretty much most full blood screening, depending on what it's for, within our scope of practice. And obviously, we would act as that referral. So normally, if you were wanting your bloods done, you do need a referral in to get blood testing done. But obviously, we would provide that referral for you and do the screening and then get the results. And then if anything did flag up, it would be our job to then flag that immediately with your GP, who then expedites the whole process. So it then means that it's just dealt with a lot faster. So hopefully that makes sense. It can be a bit of a frustrating time when you're waiting in results and sometimes just getting an appointment. So it can just help speed the process up and make it a little bit more pleasant. Now in here, I think our kind of blood taking is fairly pleasant. Anybody that's been in where I've taken their blood has always said how easy it was. I've had a few patients who have said, well, they've always had issues with phlebotomists finding a good vessel to get the blood out of. And yeah, there can be some tricky ones, but one of the things that we invested in last year was a little vein light. I'll show you, it's quite funky. So nobody likes needles, and getting your blood taken, it's always a wee bit fun. It's always a wee bit. So these are the vacutainers over here. You get different blood collection tubes for the samples that get sent to the pathology lab. But essentially, this is a little vein light, and it helps us find the best vein to get your blood out of, and because that's the biggest fear for everybody. You don't want us prodding about. So look at how funky this is. But essentially, I don't know if you can see that. Come closer to the camera. As I go across, you see how the vein shows up dark. And then I'll turn it that way. It's maybe easier for you to see. See it? So there's my big lovely vein there, that darkness. And it just means that us going in as phlebotomists are able to just go in and find that vessel, no bother. And it's great for patients where they've got a really deep vein. So my husband, where I've taken his blood a number of times, he's had a lot of surgery in one of his arms, and his vessels are all over the place. And he's always like, oh no, I need to get this done. And he was like, that's amazing, that little light, because it's less of a trauma for him, put it that way. So rest assured that the process is it's actually really simple and really easy. And with little things like that, we do make it a wee bit more pleasant for you. It's less that scary when I get my bloods done. It's I wouldn't say it's not a pleasant experience, but it's quick and it's easy. Even with those tricky veins where they're that wee bit harder to find with the vein light. It really just takes that problem that you may have had in the past with different phlebotomists trying to find your vein. It's a nice wee thing. It also holds the vessel a lot of the time when we're putting the needles in to collect. Vessels roll, so that it actually holds the vessel in place. So it's a great wee device. Anyway, I'm rambling on. If you are interested, please don't hesitate to reach out. It's not really something you would say, oh, I need these tests done. That's really for us to say we would recommend this XYZ testing, depending on what you're worried about. But if you're worried about general health and you want to come in, maybe have us, just check you over, so that, you're maybe getting odd sensations in your feet, or maybe you're just feeling your balance is going, or you're, whatever it is, especially lower limb. We are podiatrists, so anything kind of lower limb, or maybe you're getting a little bit of back pain, knee pain, hip pain. Do book an appointment, book a general consultation. If we felt that there was a need to get a blood test, then that's something we can absolutely do. We wouldn't just do it willy-nilly. So it's not like you would just go in and say, oh, I need a blood test. Well, why do you need a blood test? So it's not just a case of unethically testing you. It's about joining up that management plan. And as I said, it really has taken away that bottleneck for us. It was a big problem for us that we weren't able to quickly get those results for patients. And for many cases, it was holding up their treatment plan, or meaning that their treatment plan was just a wee bit less like, is it this, or is there involvement with the immune response, or is it something else? Is it nothing to do with that? So it really has helped that way. There was one, just give you an example, which really, this is where it inspired me or pushed me to actually, I'm going to offer blood sampling. I always wanted to do PRP, so I had to do my phlebotomy training, but I didn't really intend or set out to offer blood testing and collecting blood and doing that. It wasn't really on my radar, but it's only through working in practice, realising and the frustrations and the time, and how that I wasn't able to quickly manage that patient's management plan. I had a young girl, this was last year, and she had come in and she was 17, and she had lower back pain from about the age of 12, and she'd been seen lots of different people over the course of that year, to the extent where they had told her parents that they thought it was a mental health problem. She had it was in her head, this pain, and which is, I don't know the full back history of that, but that, that's quite a big statement to say. And this wee girl, our young lady now, was at the end of her tether. She had finished school, she was starting university, and just agonising, crippling pain that just was really limiting her life. So the thought process came to me because she'd been referred over as possibly some rehabilitation, some strength work, possibly doing some Pilates with her, maybe some manual therapy, just really help her, feel better. But when I was taking her history and listening to her and listening to that backstory and listening to her symptoms, there was a few red flags there for me that I didn't like. And when I asked her mum and herself about different blood tests that she'd had a ton of tests, imaging, MRI even. And so she had a blood test, but unfortunately it had been many, many years ago, and she'd forgotten what she'd had. And I had asked if they had checked her for rheumatoid factor. She believed that they had done that test. I don't know whether they had or hadn't, and whether or not how that had come up. So my kind of inkling with this young girl was a possible ankylosing spondylitis. Now, I didn't say that to the patient because you don't want to, it's not my job to diagnose that, but it was in the back of my mind that this was a possibility given her presentation and where she was at age and everything that was going on with her. And so I requested from her GP, and she was really reluctant for me to write to the GP given the history, and I think that being told that it was a mental health problem and not anything else. And so I wrote to the GP with my suspicions and requested that she be checked specifically for zero negative testing for ankylosing. My suspicion was ankylosing spondylitis, and it came back positive. And that really, now that whole process though it was about 8 weeks to get her to the point of getting the results back of those tests. That's 8 weeks delayed treatment, 8 weeks of not fully knowing what's going on with that girl, 8 weeks of her not getting the right medication that she needed to actually get her out of pain and get her living a life again. Now, and 90% of the times that these tests would come back negative, and that's what you want. You don't want to find something wrong. But here was this wee girl from the age of 12 up to 17, to the extent where she'd been told that it was in her head. I don't know the full history of that, but that's obviously, I'm getting that one side of that. It just frustrated me. And it just made me want to have a more joined up service where we know exactly what's been done with that patient. We know what our suspicions are. We can rule things out. We get the results very promptly. In many cases, within 24 hours, the results are there. And we can then get that, we can manage that patient right from point A to point B, making sure we bring in any other healthcare professionals that need to. So in that case, she's been referred to rheumatology and on the appropriate medication. But it's just situations like that's what inspired me. That really was what pushed me to do it, was just trying to join up that service, because it was quite frustrating and quite stressful for that young girl. I mean, for all those years, that just really pains me to think, for, you know, what are we on? 5 years she's been through the war, really, but all the time she didn't. I don't know what testing was done and what's happened, but it just wasn't found. So it's important that, you know, we don't assume that there's always something wrong, or that there's some inflammatory, or there's something there. But in some cases there are, and it's important that we rule those red flags out. That particular case, with the case history and her symptoms, it just didn't sit with me, and I wanted that ruled out. And unfortunately, it did come back positive. But I mean, it's not a good thing that the ankylosing spondylitis was a diagnosis, but it's good that we have got that answer and that it's getting dealt with, and that she's finally living a life and not in as much agonising pain. But it is a life limiting, and it was something that she'll have to manage the rest of her life. But at least we have that answer there. It's that unknown, I think, that drives patients insane. And as a clinician, I think anybody that works in healthcare, you just want to do your best for your patients. So it's being able to join that up. So this was really the big pushing, driving factor, was being able to join that up. And a lot of our patients, even from that diabetic, managing their diabetes, a lot of people are, you know, probably got diabetes and they don't know they've got it. And routinely, you know, when we get a new patient in here, we do a full screening. So when you come in, depending on your case history, you know, so if you're over the age of 50, you're going to get your blood pressure taken. We're going to recommend that, you know, certainly if you're overweight, maybe feeling a bit tired, any other symptoms like maybe urinating at night, we are going to check and screen your glucose. Why would we not do that? It's the chances of you having diabetes is probably is fairly high. So we're going to rule that out, depending on your case history. Not every single person coming in we would recommend that, but it's certainly something we want to be able to do for our patients, managing those patients and helping them take control of their health by checking every 3 months their HbA1c, helping them manage that as well and joining that up a wee bit better. I just think that sometimes, I don't know, we kind of fall within the health service and with care, where we need to take control of our own health. And I think sometimes patients hand over, or somebody's meant to tell me when I'm meant to go for that test, but that isn't actually what happens, and that isn't what we want to happen. We need to take control of that. But sometimes, you know, having that healthcare provider give you that wee nudge of how are you doing, how's your blood sugar levels, have you been screened, are you screening, are you meant to be screening, how's the diet going, you know, all of that kind of stuff. Just giving you those wee nudges along the way is quite handy. But you know, that isn't the NHS's job. And I think sometimes many patients have these expectations that it is, but it isn't. There just isn't the resources for that. And we all have to take responsibility for our own health. But that's where private health can come in. It's a wee bit more hand-holding. It's a wee bit more, we will prompt you. You're kind of handing it over a little bit, with a little bit of hand-holding, I suppose is how I would describe it. So that's kind of what we're doing. But if you are interested in coming in, please do come in. But do know, new patients, depending on your presentation, we might recommend blood screening for various different things if it's indicated. If you're worried about a particular thing, please do reach out to us. We can certainly help. And if we feel that you need any particular testing done, then we can provide that referral for you. But we're really just here to offer this additional service. It's available now, and we just wanted to let you all know about it. But know that it isn't just a big willy-nilly, you can just book blood screening and blood tests with for no reason. That isn't the case. It's all about linking that up to your case history and is it indicated. So if you have any questions, don't hesitate to give us a phone, pop us a direct message, or email us over. I've put the details in this live video of me to the booking link and things as well, so you can book in. Just book a routine new patient podiatry if you're new, and we can discuss. So at your initial consultation, we would be checking what needs checked, whether it's your vascular status, whole host of different things, blood pressure. If there was any blood testing needing done at that time as well, we could easily do that there and then as well. All right, have a fabulous day, and